Dr. C.
Almost finished.
Almost finished, but we
Yes.
can start to discuss. This is a really good a good procedure, and this is the totally unblock enucleation with bipolar.
Yes.
Is right.
Thank you very much.
No, is really interesting because I think that it's not so easy with this kind of loop to do this circumferential enucleation of the prostate, because in my opinion is a little bit too big for finding the right plane. But you did really a good surgery. What do you think about the early detachment of the adenoma? Do you think really is really important for maintaining the continence and to have a early continence after the enucleation?
Yes. According to our experiences, it's very important because with the help of ultrasound guidance in our early experiences, because we find if we have measured during the ultrasound navigation from the at the 6 point proximal to viru, from this point to external sphincter is about 1.5 centimeter. And just from this point opposite to the 12 o'clock is about 1.3 centimeter. So if we make a marker, it will avoid damage the external sphincter, keep safe, especially for this beginner.
Yeah. See that also the traction that you have when you push, especially when you push towards the bladder, this traction can really make this strength to the sphincter and give this sphincteric urinary incompetence that sometimes after the enucleation we had in some surgery.
Also make the surface
yes, you're
of
right.
surgical capsule
you have a very
smooth.
Good question and very good comments because my experience is usually not to use the mechanical force. So you can find I always perform the enucleation under the direct vision and use the Dayu scalpel because it have a fine rigidity and controllability. It will help us when I get into the right plane. I will not use mechanical force, but use coagulation. You can find it will have a mild explosion force, and can dissect the
I want
along
really
the right plane.
Congratulate because this is what I want to underline, that you use the energy to do the enucleation and not the mechanical dissection, because especially with this kind of prostate not so big, you can disrupt the adenoma and immediately losing the right plan. So
yes, right.
We saw your really slow movement around the prostate, and this is really difficult. It's not you make this simple, but it's not simple. I know I have experience in enucleation, and what I saw is this very slow detachment of the adenoma with a very good job, and also on the other end not disrupting the capsula. Because sometimes if you push too much, you can open the capsula, you can have this venous bleeding that can stop your surgery, and you have to finish with the resection.